How quickly does radioactive iodine clear from your body? Imagine a tiny radioactive atom traveling through your body after a diagnostic or treatment dose. How long does it stay, and when is it safe to go about your day? When radioactive iodine is used for thyroid tests or therapy, it mainly leaves your body through your urine. The rate at which this happens can vary from person to person, but we have some solid scientific facts to guide us. On average, the effective half-life of radioactive iodine in the entire body is about 10 to 11 hours. This means that every 10 to 11 hours, half of the radioactive iodine present is eliminated. This rapid initial phase is when most of the iodine is expelled, mainly through urine, saliva, and sweat. Within the first 2 days after administration, the majority of the radioactive iodine is gone from your system. This quick clearance is why patients are often advised to follow certain safety precautions during this period. However, some iodine remains in the thyroid tissue or any residual cancerous tissue. This leftover iodine can stay in the thyroid for several days or even weeks, depending on the amount of tissue and the treatment specifics. Because of this, the total time for the body to completely clear radioactive iodine, considering both biological processes and the natural decay of the isotope, is about 5.5 days. This longer half-life reflects the slow releases of iodine from thyroid tissue, which can continue to emit low levels of radiation during this time. It's also interesting to note that, if someone has been exposed to iodine contrast agents used in imaging tests, it can take several weeks to months for iodine levels to return to normal. Typically, iodine levels normalize around 6 weeks after exposure, but this is more about stable iodine levels than radioactive iodine clearance. In practical terms, most patients will see radiation levels drop significantly within the first 3 days after treatment. By about a week, the radiation is usually very low and poses minimal risk. This is why radiation safety guidelines recommend avoiding close contact with pregnant women and young children for a few days after radioactive iodine therapy. To sum up, radioactive iodine clears from your body into main phases. The initial rapid phase sees half of the iodine eliminated every 10 to 11 hours, removing most of it within 2 days. The second, slower phase takes about 5.5 days overall, as residual iodine in thyroid tissue gradually diminishes. Always remember that individual factors like age, kidney function, and thyroid tissue amount can influence this process. If you're undergoing radioactive iodine procedures, your healthcare team will monitor your radiation levels and advise you on safety measures. For personalized advice and safety, always consult your medical provider.